Sophia doesn't have any pain, and I was contemplating giving her some so that I can show her how to take it away. Please understand, when you're working with pain, you need to get a medical referral. You don't, pain is a signal. Your body is very smart, smarter than you even imagine. So when people are feeling pain, it's a signal. You need to know that they have checked out what that signal is telling them before you ever want to work with them, because hypnosis is amazing for taking away pain. But if you take away pain that is an indication of something else, then you're not helping anymore. And first rule is, do no harm, ever. So get a medical referral before working with pain. One way I like to do it just conversationally. Now, I watched Dan Cleary do this, and I'm going to say, do you have any, can I just kick you a little bit and give you a little? Okay.
Actually, I do have a little pain.
Notice how quickly she finds that pain when I offered to kick her. Thank you, Sophia. So what I'd like you to notice about this discomfort is if you were to give it a color. If you were to say that it's a certain color right now, what color would that be?
Like a gray.
Like a gray, okay.
Like a dreary gray.
And what color do you think would feel better? If you could choose any color that would make it feel better.
Like a nice bright blue.
Ah, bright blue, good. What I want you to do is imagine it right now, already changing, already turning into a bright blue that feels better. Now, if I were to say that you could wrap this and make it feel even better, to wrap this discomfort in a very soothing material, what kind of material do you find the most soothing? I don't know, cotton, silk, velvet. You tell me, what would be the most comfortable?
Nice cooling silk.
A cooling silk, good. So imagine now that bright blue silk that you're wrapping where that discomfort was. That you're wrapping it, and as you're wrapping it, that comfort's sinking in. It's sinking in, and it's wrapping it, and it's protecting it, and it's comforting it. So where that discomfort was, there's now this soothing silk, this soothing feeling, this sensation. And you might notice already that it feels differently. Does it feel better? Mm-hmm. Good. Excellent. Now, that technique, there's so many variations of it, and let me just explain the elements. You want to get people to focus on the color, or sometimes the shape, sometimes the size, sometimes the texture. Okay, and what that already does is it dissociates just a little bit, even when they're focusing on something inside. It gives them power over it. Now they can change it. Okay, so to change it to a color, and notice the embedded commands that feel better. What do you think would feel better? Okay, it's the interspersal technique. You just want to keep firing off those things. When you then wrap it in something soothing, something that's going to protect it and soothe and feel that comfort sinking in. This is all language that's going to produce change.